Hey guys, Dr. Joseph Houlik here. Today we're going to be talking about oral probiotics, what they are, do they work, and why you should even consider them. Probiotics, live microorganisms, bacteria, fungi that somebody takes to experience some sort of benefit or health benefit from them. So the first thing you probably think of is like, a pill that you take to help with your gut or your GI tract. Now, instead of the gut, these are designed for your mouth. So they are two completely different things. They're designed to help balance the normal oral flora. Say that 10 times fast. What that means is balance all the bacteria, fungi, and other microorganisms in the mouth. Keep in mind, bacteria in the mouth are part of what causes bad breath, cavities, gingivitis, periodontitis, and more. So with probiotic, we're taking healthy bacteria, putting them into our mouth to then help offset, limit, or reduce some of the negative effects or things that the other bacteria in the mouth are doing. Seems pretty simple. Keep in mind here, this is very important. Keep in mind, these are not meant to be substitutes for brushing, flossing, and a great oral hygiene routine. They are meant to be kind of a supplement, something that you would add to your routine versus like being your only part of your routine. Do they work? The research and the literature on this is really interesting. So what it says, they seem to be very beneficial and promising at reducing cavities, gingivitis, periodontitis, bad breath or halitosis, and also in reducing mucositis, which is like inflammation in the mouth for cancer patients. The research shows that they can actually be very beneficial, but the research also shows it needs more research. That's a classic thing with research is it says these seem to be very promising, but we need some more studies to really figure this out to advise you guys better on this. So that's where it stands right now. Now I looked up a lot of these products. They come in the form of like a lozenge, which I also believe is a ski resort in Europe somewhere, tablets, sometimes rinses. It's going to be a combination of the different bacteria that we discussed, one of which the most important one is L. salivarius and then L. reuteri. And then they have some other things like for flavor. So the effects of these can last for a couple days, looks like maybe even a couple weeks, but it is more of like a long-term kind of continuous use thing to experience the benefits of this. So I also tried to look for long-term negative consequences of using these types of products as far as like, what's the downside to using these? And I couldn't really find a whole lot yet. And that's probably just because some of the research is limited. But who seems to benefit most from these? Well, if you're somebody who honestly doesn't really seem to be having any dental problems, then I don't know if you really need to worry about adding these to your routine. If you're somebody who has a higher level of the bacteria that cause halitosis or bad breath in your mouth, and maybe talk to your dentist and they may be worth a shot. If you're somebody who feels like you do everything that you can, but you still chase your tail fixing your teeth and your gums, I have some patients like this at my practice, then it may be worth discussing with your dentist to maybe try these and see if you can get any improvement on them. I also think in the future, moving forward, it seems like these could be helpful or promising potentially maybe for children, maybe for elderly patients, maybe for people whose oral hygiene routine or care is not quite established yet, or they just physically or mentally have a more difficult time doing that, in addition to people who maybe don't have as much access to care. So it'll be interesting to see how all this plays out in the future and if it's something that people incorporate more and more into their routine. So hopefully you guys got some value and some helpful information out of that video. If you did, please consider subscribing to the channel and give us a thumbs up, like, or comment with your questions below. As always, thank you guys for your time.